You've checked your blood sugar and it's high. Maybe it's 180, maybe it's 200, maybe it's even higher. And you're sitting there thinking, what do I do right now? Not tomorrow, not next week, but right now in this moment. That panic sets in because you know high blood sugar isn't just a number on a screen. It's damaging your body with every minute it stays elevated. I'm Dr. Michael Richardson, a nutritionist who helps people balance their blood sugar, improve their metabolic health, and understand their bodies on a deeper level. And today, I'm going to show you exactly how to lower blood sugar fast. Not with some magical supplement or expensive medication, but with strategies that work with your body's natural systems. If you watched my previous video on the foods that spike blood sugar the most, you already know what to avoid. Now let's talk about what to do when your blood sugar is already high and you need to bring it down quickly. Here's the biggest misconception I see all the time. People think that when their blood sugar is high, they should just wait it out. They think their body will eventually handle it on its own. And while yes, your body will try to process that glucose, the damage is happening right now. Every minute your blood sugar stays elevated, you're creating inflammation in your blood vessels. You're stressing your pancreas. You're putting yourself at risk for complications. So waiting is not a strategy. We need to be proactive. Another huge misconception is that lowering blood sugar fast means doing something extreme or dangerous. People worry that if they bring their blood sugar down too quickly, something bad will happen. And look, there are scenarios where rapid drops in blood sugar can be problematic, especially if you're on certain medications. But for most people, dealing with high blood sugar from a meal, or stress, or lack of activity, bringing that number down efficiently is exactly what your body wants and needs. Your body is literally designed to regulate blood sugar. We're just going to help it do its job more effectively. Let me explain what's actually happening in your body when your blood sugar is high. When you eat carbohydrates, or when stress hormones are released, or when you're not moving enough, glucose builds up in your bloodstream. Think of your blood vessels like highways, and glucose molecules like cars. When there's too much traffic, everything slows down, and problems start happening. Your pancreas sees this traffic jam and releases insulin, which is like a traffic cop, directing those glucose molecules into your cells, where they can be used for energy or stored for later. But sometimes there's so much glucose that your insulin can't keep up. Or sometimes your cells have become resistant to insulin signals, like drivers ignoring the traffic cop. Either way, you end up with glucose sitting in your bloodstream, causing problems. The reason this matters so much is because glucose is sticky, literally. When there's too much of it in your blood, it starts attaching to proteins in a process called glycation. These glycated proteins can't function properly. Imagine trying to use your phone, but the screen is covered in honey. That's basically what's happening to proteins throughout your body when your blood sugar stays elevated. Your red blood cells get coated in glucose, which is actually what the hemoglobin A1C test measures. Your blood vessel walls get damaged. Your nerves start to deteriorate. This is why chronically high blood sugar leads to complications like neuropathy, vision problems, kidney disease, and heart disease. Every moment counts. So, what do we do about it? Let's talk about the key factors that control how quickly your blood sugar comes down. First, we need to understand insulin sensitivity. This is basically how well your cells respond to insulin's signal to take in glucose. If you're insulin resistant, it doesn't matter how much insulin your pancreas produces. Your cells aren't listening. It's like someone knocking on your door, but you're wearing noise-canceling headphones. You can improve insulin sensitivity quickly through movement, which we'll talk about in detail. But the key thing to understand is that insulin sensitivity is not fixed. It changes throughout the day based on what you do. Second factor is muscle glucose uptake. Your muscles are like sponges for glucose. They can absorb huge amounts of it, especially when they're active. But here's what most people don't realize. Your muscles don't need insulin to take in glucose when they're contracting. They have a separate pathway called GLUT4 translocation that's activated by muscle contraction itself. This is huge because it means even if you're insulin resistant, movement can still bring your blood sugar down. Your muscles are doing the work that insulin normally does. Think of it like having a backup generator when the power goes out. Third factor is liver glucose production. Your liver is constantly making glucose and releasing it into your bloodstream. This is called gluconeogenesis, and it happens even when you're not eating. Your liver does this because your brain and other organs need a steady supply of glucose to function. But when your blood sugar is already high, the last thing you need is your liver dumping more glucose into your system. Certain activities and strategies can signal your liver to stop producing glucose and actually start storing it instead. We're going to use this to our advantage. Fourth factor is incretin hormones. These are hormones released by your gut that enhance insulin secretion and slow down digestion. The most important ones are GLP-1 and GIP. You've probably heard of GLP-1 recently because of medications like Ozempic and Wegovy. But your body makes its own GLP-1 naturally when you eat certain foods and do certain activities. We can stimulate these hormones naturally to improve your blood sugar response. They basically make your body better at handling glucose without any medication. Fifth factor is stress hormones. Cortisol, adrenaline, and noradrenaline all raise blood sugar. They do this because they're preparing your body for action. In a survival situation, you need quick energy. So these hormones tell your liver to release glucose, and they make your cells more insulin resistant so that glucose stays in your bloodstream, available for immediate use. This was great when we were running from predators. Not so great when you're stressed about work while sitting at a desk. Managing stress hormones is crucial for bringing blood sugar down quickly. Now let's get into the actual step-by-step action plan. These are things you can do right now, today, the moment you see that high blood sugar reading. I'm going to give you 7 specific steps in order of priority and effectiveness. Step 1 is movement, specifically what I call glucose clearing walks. The moment you see a high blood sugar reading, you need to move. I don't care if it's raining. I don't care if you're tired. I don't care if you just ate and feel full. You need to get up and move for at least 10 to 15 minutes. A brisk walk is ideal, but even walking in place or doing light exercises in your living room will work. Here's why this is so effective. When your muscles contract, they immediately start pulling glucose out of your bloodstream. Remember that GLUT4 pathway I mentioned. It activates within seconds of movement. Studies show that a 15-minute walk after a meal can reduce blood sugar spikes by up to 30%. But even if your high blood sugar isn't from a meal, movement still works because your muscles are creating a demand for glucose. The key is intensity. You want to walk fast enough that you can still talk, but you're slightly breathless. You're not jogging, you're not running, but you're moving with purpose. This level of intensity activates both your aerobic and anaerobic energy systems, which means your muscles are burning through glucose rapidly. If you can't walk outside, march in place, do bodyweight squats, do arm circles, do anything that gets your large muscle groups working. Your legs have the biggest muscles in your body, so using them is most effective. But upper body movement helps too. How long should you move? minimum 10 minutes, but 15 to 20 is better. You should see your blood sugar start to drop within 30 minutes of starting your movement. If you check your blood sugar right after exercise, it might actually be higher temporarily. Don't panic. This is because exercise initially triggers some stress hormones that release a bit of glucose. But within 30 to 60 minutes after you stop moving, your blood sugar should be noticeably lower. The glucose your muscles pulled in during exercise, plus the improved insulin sensitivity you created, will bring those numbers down. Step 2 is hydration with a specific strategy. When your blood sugar is high, your kidneys try to filter out excess glucose through your urine. This is why frequent urination is a symptom of high blood sugar. Your body is literally trying to pee out the sugar. But this only works if you're well hydrated. If you're dehydrated, your blood becomes more concentrated and your kidneys can't filter as effectively. So you need to drink water. Not juice, not soda, not even diet soda. Just plain water. I want you to drink 16 to 20 ounces of water immediately. Then sip another 8 to 16 ounces over the next hour. But here's the trick that most people miss. Add a pinch of sea salt and a squeeze of lemon to your water. The salt provides electrolytes that help your body actually absorb and use the water instead of just peeing it straight out. When you're properly hydrated with adequate electrolytes, your blood volume increases, which dilutes the glucose concentration. Your kidneys can work more efficiently to filter out excess glucose, and your cells can take in glucose more easily because proper hydration improves cell membrane function. Think of your cells like sponges. A dry sponge can't absorb anything. A moist sponge absorbs easily. Hydration keeps your cells ready to absorb glucose. The lemon adds a tiny bit of citric acid, which can slightly slow gastric emptying if you've recently eaten. This means the remaining food in your stomach gets released more slowly into your intestines, which prevents additional blood sugar spikes. Plus, the sour taste can help reduce cravings for sweet foods, which is helpful when your blood sugar is high and you might feel tempted to eat more. Don't overdo the lemon though. A squeeze from 1/8 of a lemon is plenty. We're not trying to make lemonade here. Step 3 is vinegar or lemon juice before your next meal. If your blood sugar is high and you know you're going to eat again within the next few hours, you need to prepare your body to handle that incoming food better. About 10 to 15 minutes before you eat, consume 1 tablespoon of apple cider vinegar, diluted in a glass of water. If you can't stand vinegar, you can use the juice of half a lemon instead. The acetic acid in vinegar and the citric acid in lemon both do something remarkable. They temporarily inhibit enzymes that break down carbohydrates, and they slow down gastric emptying. What this means in practice is that the carbohydrates in your meal get broken down more slowly and absorbed more gradually. Instead of a sharp spike in blood sugar, you get a gentler rise that your body can handle more easily. Multiple studies have shown that consuming vinegar before a meal can reduce the blood sugar spike by 20 to 30%. That's massive. It's like having a natural medication that costs pennies and has no side effects. Well, except maybe the taste. I'll admit it's not delicious, but it works. The timing matters here. You want to consume the vinegar or lemon juice on an empty stomach about 15 minutes before eating. This gives it time to get into your system and start affecting those digestive enzymes. If you drink it with your meal, it's less effective. If you drink it hours before, the effect will have worn off. 15 minutes is the sweet spot. Some people worry about vinegar damaging tooth enamel. This is a valid concern with undiluted vinegar. That's why you must dilute it. 1 tablespoon in 8 ounces of water is safe, and you can drink it through a straw if you're extra cautious. Then rinse your mouth with plain water after. Step 4 is targeted breathing exercises to lower stress hormones. Remember how I mentioned that cortisol and adrenaline raise blood sugar? Well, you can actively lower these hormones with specific breathing techniques. When your blood sugar is high, especially if it's high due to stress rather than food, you need to activate your parasympathetic nervous system. This is the rest and digest system that counteracts your fight or flight response. The fastest way to do this is through controlled breathing. Here's the technique. Sit or lie down in a comfortable position. Breathe in slowly through your nose for a count of 4. Hold your breath for a count of 4. Breathe out slowly through your mouth for a count of 6 to 8. The key is making your exhale longer than your inhale. This signals to your nervous system that you're safe and there's no emergency. Do this for 5 to 10 minutes. You should feel your heart rate slow down. Your muscles will relax. And most importantly, your stress hormones will drop, which allows your blood sugar to come down. This isn't just woo-woo relaxation stuff. There's solid science here. When you extend your exhale, you stimulate your vagus nerve. This nerve controls your parasympathetic nervous system. Vagus nerve stimulation lowers cortisol and adrenaline. Lower stress hormones mean your liver stops dumping glucose into your bloodstream, and your cells become less insulin resistant. Plus, deep breathing increases oxygen delivery to your cells, which helps them metabolize glucose more efficiently. Some studies suggest that regular breathing exercises can improve hemoglobin A1C levels over time. But even in the short term, a 5-minute breathing session can help bring down stress-induced blood sugar spikes. Step 5 is strategic protein and fat intake. If your blood sugar is high and you haven't eaten recently, or if you ate mostly carbohydrates, your next eating decision is crucial. Do not eat more carbohydrates. I don't care how hungry you feel. Adding more carbs when your blood sugar is already elevated is like throwing gasoline on a fire. Instead, if you absolutely must eat something, choose protein and healthy fat with minimal to no carbohydrates. A handful of almonds, some turkey slices, a hard-boiled egg, a piece of cheese, Greek yogurt with no added sugar. These foods will satisfy your hunger without raising blood sugar further. But here's what's really interesting. Protein actually stimulates insulin release, but in a much more controlled way than carbohydrates do. When you eat protein, your pancreas releases insulin gradually over several hours. This gentle insulin release can actually help bring down existing high blood sugar by improving glucose uptake into cells without causing the dramatic spikes and crashes that come from carbohydrate insulin responses. Fat has virtually no impact on blood sugar at all. It doesn't require insulin, so combining protein and fat gives you satiety, stable energy, and potentially even helps lower your elevated blood sugar. The portion size matters here. We're not talking about eating a giant steak. A small serving is all you need, 2 to 4 ounces of protein, which is about the size of your palm. A tablespoon or 2 of healthy fat, like nuts or avocado. This is enough to curb hunger and provide those metabolic benefits without overloading your digestive system. If you're not hungry, don't eat at all. But if hunger is making you miserable and you're worried you'll cave and eat something that will spike your blood sugar even higher, a small serving of protein and fat is your best option. Timing your next meal properly is also part of this step. If your blood sugar is high, you should wait until it comes back down into a normal range before eating carbohydrates again. For most people, this means waiting at least 2 to 3 hours after a high reading before consuming any significant amount of carbs. I know this can be tough if you're on a rigid meal schedule, but think about it logically. If your body is still struggling to process the glucose already in your bloodstream, why would you add more? Give your system a chance to catch up. When your blood sugar does normalize, then you can eat a balanced meal with smart carbohydrate choices. Step 6 is cold exposure if you have access to it. This one is optional, and not everyone can do it. But if you have the ability to take a cold shower, or even splash cold water on your face and neck, it can help lower blood sugar through a fascinating mechanism. Cold exposure activates brown adipose tissue, which is a special type of fat that burns glucose and regular fat to generate heat. When brown fat activates, it pulls glucose out of your bloodstream rapidly. Some studies show that cold exposure can lower blood sugar by 10 to 15% within 30 minutes. You don't need to do anything extreme here. You don't need to take an ice bath. A 2 to 3 minute cold shower is enough. If that's too much, you can start your shower warm and then turn it cold for the last 30 to 60 seconds. Focus the cold water on your neck and upper back where brown fat is most concentrated. Even just splashing cold water on your face triggers what's called the mammalian dive reflex, which slows your heart rate and shifts your metabolism in ways that can help lower blood sugar. The reason this works is because cold stress is a hormetic stressor, meaning it's a mild stress that actually makes your body stronger and more efficient. Cold exposure improves insulin sensitivity. It activates your sympathetic nervous system in a controlled way that enhances glucose metabolism. And it increases circulation, which helps deliver oxygen and nutrients to your cells while clearing out waste products. Some people find that regular cold exposure helps them maintain better blood sugar control overall. But even as a one-time intervention, when your blood sugar is high, it can be surprisingly effective. If you absolutely cannot do cold exposure due to health conditions or just personal preference, an alternative is to drink a glass of cold water. Not as effective as full-body cold exposure, but the cold liquid in your stomach still triggers some metabolic responses. Your body has to use energy to warm that cold water up to body temperature, and that energy comes from glucose. Again, it's not a massive effect, but every little bit helps when you're trying to bring down high blood sugar. Step 7 is measuring and tracking your response. This might seem obvious, but so many people check their blood sugar, see that it's high, do a bunch of interventions, and then never check again to see if those interventions worked. You need data. Check your blood sugar when you first notice it's high. Write down the number and the time. Then implement the steps I've outlined. Movement first, hydration, breathing exercises, and so on. Then check your blood sugar again in 30 minutes, 60 minutes, and 90 minutes. This tells you what's working for your specific body. Everyone responds a bit differently to these interventions. Some people see dramatic drops from a 15-minute walk. Others need 20 or 30 minutes of movement. Some people respond really well to vinegar. Others find breathing exercises more effective. You need to figure out your personal pattern. Once you know what works best for you, you can respond more confidently and effectively the next time your blood sugar is elevated. Keep a simple log. Date, time, blood sugar reading, what you ate or what caused the spike, what interventions you used, and follow-up readings. After just a few weeks of this, you'll have incredible insight into your own metabolism. This tracking also helps you identify patterns you might not otherwise notice. Maybe your blood sugar is always high in the morning. That could be the dawn phenomenon, where your liver releases glucose as part of your circadian rhythm. Maybe it's always high after specific foods. Maybe stress at work consistently spikes your numbers. These patterns are valuable information. They allow you to be proactive instead of reactive. Instead of just treating high blood sugar after it happens, you can start preventing it in the first place. Now I want to address something important. Everything I've shared with you works. These strategies are backed by research and by thousands of success stories from people who've used them. But they're not magic. If your blood sugar is extremely high, like over 300, or if you're experiencing symptoms like extreme thirst, confusion, or difficulty breathing, you need medical attention immediately. These strategies are for managing moderately elevated blood sugar, not for treating diabetic emergencies. Know the difference. And if you're on diabetes medications, especially insulin or sulfonylureas, you need to be careful about combining these strategies with your medications because you could potentially go too low. Always work with your healthcare provider. Also understand that lowering blood sugar fast is a short-term solution. It's damage control. What you really want is stable blood sugar all the time. That comes from your overall lifestyle, the foods you eat regularly, your activity levels, your sleep quality, your stress management, your body composition. All of these factors determine your baseline blood sugar control. Think of it like this. These fast-acting strategies are like bailing water out of a leaking boat. They're necessary and helpful. But what you really need to do is fix the leak. You need to address the root causes of blood sugar instability. The good news is that many of the strategies I've shared today also help with long-term blood sugar control when you do them consistently. Walking after meals every day improves insulin sensitivity over time. Staying well hydrated supports healthy metabolism. Managing stress reduces cortisol chronically. Eating protein and healthy fats instead of refined carbs stabilizes your blood sugar day to day. So while you're using these tools to handle immediate high blood sugar, you're also building habits that prevent high blood sugar in the future. That's the goal. Not just reacting to spikes, but preventing them. I also want to talk about sleep because it's so often overlooked in blood sugar management. When you're sleep deprived, your body becomes more insulin resistant. Your hunger hormones get dysregulated. You crave more carbohydrates and sugar. Your stress hormones are elevated. All of this makes blood sugar control much harder. If you're consistently dealing with high blood sugar, look at your sleep. Are you getting 7 to 9 hours of quality sleep per night? Are you going to bed and waking up at consistent times? Is your bedroom dark, cool, and quiet? These things matter more than most people realize. Poor sleep affects blood sugar in multiple ways. First, it increases cortisol, which, as we discussed, raises blood sugar. Second, it reduces leptin, which is your satiety hormone, and increases ghrelin, which is your hunger hormone. This makes you feel hungrier and less satisfied after eating, which typically leads to overeating, especially carbohydrates. Third, sleep deprivation impairs your pancreas function. Your insulin secretion becomes less efficient. And fourth, it affects your brain's decision-making centers. When you're tired, you have less willpower to make healthy food choices. All of these factors create a perfect storm for blood sugar problems. Improving your sleep is one of the most powerful long-term strategies for blood sugar control. Start with a consistent sleep schedule. Go to bed at the same time every night, even on weekends. Get morning sunlight exposure within 30 minutes of waking up. This helps set your circadian rhythm. Avoid caffeine after 2 p.m. Avoid large meals within 3 hours of bedtime. Keep your bedroom cool. around 65 to 68 degrees Fahrenheit. Use blackout curtains or an eye mask. Consider a white noise machine if you're sensitive to sounds. These simple changes can dramatically improve your sleep quality, which in turn improves your blood sugar control. Another factor that deserves attention is meal timing. When you eat matters almost as much as what you eat. Your body's insulin sensitivity follows a circadian pattern. You're most insulin sensitive in the morning and least insulin sensitive in the evening. This means your body handles carbohydrates better earlier in the day. If you're going to eat carbohydrates, eating them at breakfast or lunch will generally result in a smaller blood sugar spike than eating the exact same amount at dinner. This is why so many people notice their blood sugar is hardest to control in the evening. Time-restricted eating or intermittent fasting can be incredibly helpful for blood sugar management. I'm not suggesting you need to do anything extreme, but simply limiting your eating to a 10 to 12-hour window each day can improve insulin sensitivity, reduce inflammation, and help your body regulate blood sugar more effectively. For example, if you eat your first meal at 8 a.m., finish your last meal by 6 or 8 p.m. This gives your body a solid 12 to 16-hour fasting period overnight. During this time, your insulin levels drop, your cells become more insulin sensitive, and your body shifts into fat-burning mode. This metabolic flexibility is key for long-term blood sugar health. Some people do really well with skipping breakfast and eating their first meal at noon. Others prefer to skip dinner and stop eating by early evening. There's no one right approach. The key is consistency and finding what works for your lifestyle and your body. If you're on diabetes medications, you need to be more careful with fasting, and you should definitely talk to your doctor before making major changes to your meal timing. But for most people, some degree of time-restricted eating can be a game changer for blood sugar control. Let's also talk about the quality of your carbohydrates when you do eat them. Not all carbs are created equal. Refined carbohydrates like white bread, white rice, pastries, sugary drinks, and processed snacks cause rapid spikes in blood sugar. They're quickly broken down into glucose and absorbed into your bloodstream. Your pancreas has to release a huge amount of insulin to handle this flood of glucose. Over time, this pattern leads to insulin resistance and eventually type 2 diabetes. These foods should be minimized or avoided entirely if you're serious about blood sugar control. On the other hand, complex carbohydrates from whole food sources cause much gentler rises in blood sugar. We're talking about foods like sweet potatoes, quinoa, oats, beans, lentils, and whole fruits. These foods contain fiber, which slows down digestion and glucose absorption. They also contain vitamins, minerals, and phytonutrients that support healthy metabolism. When you eat these foods as part of a balanced meal with protein and healthy fats, your blood sugar rises slowly and steadily, then comes back down gradually. This is what we want. No dramatic spikes and crashes. Just stable energy throughout the day. The glycemic index and glycemic load are useful concepts here. Glycemic index measures how quickly a food raises blood sugar compared to pure glucose. Glycemic load takes into account both the glycemic index and the portion size. Low glycemic foods are generally better for blood sugar control. But remember, you rarely eat foods in isolation. A baked potato has a high glycemic index, but if you eat it with grilled chicken, a salad with olive oil, and some steamed broccoli, the overall glycemic load of that meal is much lower. The protein, fat, and fiber from the other foods slow down the absorption of the potato's carbohydrates. This is why food combining matters so much. Always pair carbohydrates with protein and fat. Never eat carbs alone. Even something as simple as adding almond butter to your apple or having cheese with your crackers makes a significant difference in your blood sugar response. The goal is to create balanced meals where no single macronutrient dominates. This promotes stable blood sugar, sustained energy, and better appetite control. It also ensures you're getting all the nutrients your body needs to function optimally. Now let's discuss the role of strength training in blood sugar management. I've talked a lot about walking and general movement, but building muscle through resistance training is absolutely crucial for long-term blood sugar control. Muscle tissue is metabolically active. It burns calories even at rest. And most importantly, muscle is the primary storage site for glucose. The more muscle mass you have, the more capacity you have to store glucose as glycogen instead of it floating around in your bloodstream, causing problems. When you do strength training, you create tiny tears in your muscle fibers. Your body repairs these tears and builds the muscle back stronger and bigger. This process requires energy, which comes from glucose. So for hours and even days after a strength training workout, your muscles are pulling glucose out of your bloodstream to fuel recovery and growth. This dramatically improves insulin sensitivity. Studies show that a single strength training session can improve insulin sensitivity for up to 48 hours afterward. And regular strength training, done 2 to 3 times per week, can lower hemoglobin A1C by up to 1%, which is comparable to some diabetes medications. You don't need to become a bodybuilder or spend hours in the gym. Even simple bodyweight exercises done at home are incredibly effective. Squats, lunges, push-ups, planks, and glute bridges are all you need to get started. Focus on exercises that work large muscle groups: your legs, your back, your chest. These are where you'll build the most muscle mass and see the biggest metabolic benefits. Start with just 2 sessions per week, 20 to 30 minutes each. As you get stronger, you can add more exercises, more sets, or more resistance. The key is progressive overload. You need to gradually increase the challenge to your muscles over time. This could mean doing more repetitions, adding weight, or trying more difficult exercise variations. Your muscles adapt to whatever stress you place on them. If you do the same workout with the same intensity forever, your muscles won't grow and you won't see continued improvements in insulin sensitivity. But if you consistently challenge yourself, even in small increments, your body will keep adapting and your metabolic health will keep improving. Let me also address supplements, because I get asked about this constantly. There are several supplements that can support blood sugar management, but I want to be really clear that supplements are supplemental. They're not a replacement for the fundamentals of diet, exercise, sleep, and stress management. That said, certain supplements have good evidence supporting their use. Berberine is probably the most well-researched. It works similarly to metformin, improving insulin sensitivity and reducing glucose production in the liver. Typical dosing is 500 milligrams 3 times per day with meals. Alpha-lipoic acid is another one with solid research behind it. It's an antioxidant that improves insulin sensitivity and may help with diabetic neuropathy. Doses range from 300 to 600 milligrams per day. Chromium picolinate can help some people, especially if they're deficient in chromium, though the evidence is mixed. Magnesium is crucial for insulin function, and many people are deficient. I generally recommend magnesium glycinate at 300 to 400 milligrams per day. And cinnamon, particularly Ceylon cinnamon, has been shown in some studies to modestly improve blood sugar control, though the effect is small. The most important supplement for blood sugar management might actually be vitamin D. Low vitamin D levels are associated with insulin resistance and increased risk of type 2 diabetes. Many people are deficient, especially those who don't get much sun exposure. Getting your vitamin D level tested and supplementing, if needed, can make a real difference. Omega-3 fatty acids from fish oil also support metabolic health by reducing inflammation, which plays a major role in insulin resistance. A high-quality fish oil supplement providing at least 1,000 milligrams of combined EPA and DHA per day is a good starting point. Before starting any supplements, talk to your healthcare provider, especially if you're on medications. Some supplements can interact with diabetes medications. For example, berberine can lower blood sugar significantly, so if you're already taking metformin or insulin, you could potentially go too low. Supplements are tools, not magic bullets. Use them as part of a comprehensive approach, not as a shortcut around doing the hard work of lifestyle change. I want to spend a moment on the psychological side of blood sugar management because this is so often ignored. Dealing with high blood sugar, especially if you have pre-diabetes or diabetes, can be mentally and emotionally exhausting. You have to think about your blood sugar constantly. You have to make food decisions multiple times a day. You have to exercise when you don't feel like it. You have to prick your finger and see numbers that might be frustrating or disappointing. This takes a toll. It's okay to acknowledge that. Many people feel shame or guilt when their blood sugar is high. They blame themselves. They think they've failed. But blood sugar is influenced by so many factors, many of which are beyond your immediate control. Yes, your choices matter, but so does your genetics, your stress levels, your sleep, your hormone levels, your medication, and even the composition of your gut microbiome. You are not a failure because your blood sugar is high. You're a human being dealing with a complex physiological challenge. Be kind to yourself. At the same time, you need to take ownership of the things you can control. You can control what you eat, when you eat, how much you move, how you manage stress, and how much priority you give to sleep. You can control whether you educate yourself about blood sugar management. You can control whether you track your numbers and learn from them. You can control whether you work with healthcare professionals who support you. Focus on these controllable factors instead of beating yourself up over things you can't change. Building sustainable habits is more important than being perfect. You don't need to have perfect blood sugar numbers every single day. You don't need to never eat carbs again. You don't need to exercise for 2 hours daily. What you need is consistent, sustainable habits that move you in the right direction. Maybe that's walking for 15 minutes after dinner every night. Maybe it's meal prepping on Sundays, so you have healthy options during the week. Maybe it's going to bed 30 minutes earlier. Small, consistent actions compound over time into major results. The concept of metabolic flexibility is worth understanding. A metabolically flexible person can easily switch between burning glucose and burning fat for energy. Their blood sugar stays stable whether they've just eaten or haven't eaten in hours. They don't experience energy crashes or intense cravings. This is the goal. You want your body to be flexible and resilient, not dependent on constant carbohydrate intake to function. Building metabolic flexibility takes time, usually several weeks to several months, but it's absolutely achievable with the right approach. Stress management deserves its own deep dive because chronic stress is one of the most underappreciated drivers of poor blood sugar control. When you're stressed, your body thinks you're in danger. It releases cortisol and adrenaline to prepare you for action. These hormones raise blood sugar to provide quick energy. They also make your cells insulin resistant, so that glucose stays available in your bloodstream instead of being stored away. This was adaptive when stress meant a physical threat that required immediate action. But modern stress is chronic and psychological. You're not fighting or fleeing. You're sitting in traffic, or dealing with work deadlines, or worrying about finances. Your body doesn't know the difference though. It still releases those same hormones. Chronic stress also affects your food choices. When you're stressed, your brain craves quick energy and comfort, which usually means sugar and refined carbs. Stress reduces your willpower and decision-making ability. It disrupts your sleep, which further impairs blood sugar control. And stress increases inflammation throughout your body, which worsens insulin resistance. It's a vicious cycle. High stress leads to high blood sugar, which creates more stress about your health, which raises blood sugar even more. Breaking this cycle requires intentional stress management practices. Different stress management techniques work for different people. Some people find meditation incredibly helpful. Even just 5 minutes of quiet sitting and focusing on your breath can lower cortisol levels. Apps like Headspace or Calm can guide you if you're new to meditation. Others prefer physical activity like yoga or Tai Chi, which combine movement with mindfulness. Some people benefit from therapy or counseling to work through underlying issues causing chronic stress. Spending time in nature, connecting with loved ones, engaging in hobbies, listening to music, journaling. There are countless ways to manage stress. The key is finding what actually works for you and doing it consistently. One thing I've noticed is that people often wait until they're completely overwhelmed before they try to manage stress. Don't do this. Stress management should be preventive, not reactive. Build it into your daily routine just like brushing your teeth. Maybe you meditate for 5 minutes every morning. Maybe you take a walk during your lunch break. Maybe you have a wind-down routine every evening. Whatever it is, make it non-negotiable. Your blood sugar and your overall health will benefit immensely. Let's talk about community and support, because trying to manage blood sugar alone is much harder than doing it with support. Whether it's family members, friends, an online community, or a support group, having people who understand what you're going through makes a huge difference. They can encourage you when you're struggling. They can share strategies that worked for them. They can hold you accountable to your goals. And they can remind you that you're not alone in this. If you don't have support in your immediate circle, seek it out online. There are countless forums, Facebook groups, and communities dedicated to blood sugar management and diabetes support. If you live with family or have close friends, educate them about what you're dealing with. Help them understand why you're making certain food choices or why you need to exercise after meals. Most people want to be supportive, but they can't help if they don't understand. And if someone in your life is unsupportive or actively undermines your efforts, you may need to set boundaries. Your health has to come first. You don't need anyone's permission to take care of yourself. Working with healthcare professionals is also crucial, especially if you have prediabetes or diabetes. A good doctor will partner with you, not just prescribe medications. They'll listen to your concerns, answer your questions, and adjust your treatment plan based on your individual needs and goals. If your doctor isn't doing this, find a new doctor. A certified diabetes educator can teach you about blood sugar management in detail. A registered dietitian can help you create a meal plan that works for your lifestyle and preferences. An exercise physiologist can design a workout program tailored to your abilities and goals. These professionals are invaluable resources. Use them. Technology can also be a powerful tool. Continuous glucose monitors, or CGMs, allow you to see your blood sugar in real time throughout the day. You can see exactly how different foods affect you. You can see how exercise brings your numbers down. You can see how stress or poor sleep impacts you. This real-time feedback is incredibly educational and motivating. CGMs used to be only for people with type 1 diabetes, but now they're more accessible. Some people, without diabetes, even use them temporarily, just to learn about their body's responses. If you can afford it and your insurance covers it, a CGM might be worth exploring. Even without a CGM, a regular blood glucose meter is essential if you're managing blood sugar issues. Test strategically. Fasting blood sugar, first thing in the morning. Blood sugar before meals. Blood sugar 1 to 2 hours after meals. Blood sugar before and after exercise. These data points tell you so much about how your body is functioning and how different interventions affect you. Don't just test randomly and get frustrated by high numbers. Test with purpose. Use the information to make informed decisions. Let me also address alcohol, because this comes up frequently. Alcohol affects blood sugar in complex ways. Initially, it can cause blood sugar to rise, especially if you're drinking beer or sweet mixed drinks that contain carbohydrates. But then, as your liver processes the alcohol, it stops producing glucose. This can lead to low blood sugar several hours after drinking, especially if you haven't eaten. The delayed hypoglycemia from alcohol is dangerous, particularly if you're on insulin or certain diabetes medications. People have been known to go to sleep after drinking and have severe low blood sugar in the middle of the night. If you do choose to drink, do so carefully. Limit yourself to 1 or 2 drinks maximum. Never drink on an empty stomach. Eat a meal with protein and fat before or while drinking. Avoid sugary mixers and sweet drinks. Stick with dry wine, light beer, or spirits mixed with soda water and lime. Check your blood sugar before bed and consider setting an alarm to check during the night if you've had more than 1 drink. And never drink and then exercise, as this combination can cause dramatic drops in blood sugar. Honestly, if you're trying to optimize your blood sugar control, minimizing alcohol or avoiding it entirely is probably your best bet. The gut microbiome is an emerging area of research that's fascinating for blood sugar management. The trillions of bacteria in your digestive system influence how you absorb nutrients, how you respond to insulin, and even how you feel and behave. An unhealthy gut microbiome, often called dysbiosis, is associated with insulin resistance, inflammation, and metabolic dysfunction. On the other hand, a diverse, healthy microbiome supports stable blood sugar and overall metabolic health. You can support your gut microbiome through your diet. Eat plenty of fiber from vegetables, fruits, legumes, and whole grains. Fiber feeds the beneficial bacteria in your gut. Include fermented foods like yogurt, kefir, sauerkraut, kimchi, and kombucha, which contain probiotics. These are live beneficial bacteria that can colonize your gut. Minimize ultra-processed foods, artificial sweeteners, and excessive antibiotic use, all of which can harm your microbiome. Some people benefit from a probiotic supplement, especially after antibiotic treatment, though eating probiotic-rich foods is generally more effective. There's also fascinating research on something called colonic fermentation. When you eat fiber and certain resistant starches, your gut bacteria ferment these compounds and produce short-chain fatty acids like butyrate. Butyrate has powerful effects on metabolism. It improves insulin sensitivity. It reduces inflammation. It strengthens the gut barrier. You can increase butyrate production by eating more fiber, especially from vegetables and legumes, and by eating resistant starch from foods like cooked and cooled potatoes and rice, green bananas, and oats. This is another reason why whole foods are so much better than processed foods. You're not just getting nutrients. You're feeding the beneficial organisms that live inside you. Now, I know I've thrown a lot of information at you. It might feel overwhelming. You might be thinking, how am I supposed to do all of this? Here's the truth. You don't have to do everything at once. In fact, you shouldn't try to. Trying to overhaul your entire life overnight usually leads to burnout and giving up. Instead, start with 1 or 2 things. Master those. Build them into habits. Then add something else. This gradual approach is much more sustainable and ultimately more successful. If I had to prioritize, I'd say start with these 3 things. 1. Walk for 15 minutes after your main meals, especially dinner. 2. Drink plenty of water throughout the day and stay hydrated. 3. Focus on eating protein and vegetables at every meal, with carbohydrates playing a supporting role rather than the main role. Just these 3 changes, done consistently, will make a significant difference in your blood sugar control. Once these become automatic, you can layer in additional strategies like strength training, time-restricted eating, stress management, and better sleep. Progress isn't linear. You'll have good days and bad days. Your blood sugar won't be perfect every single day. That's okay. What matters is the overall trend. Are you moving in the right direction? Are you building sustainable habits? Are you learning and adapting? If the answer is yes, you're succeeding. Even if individual days or weeks are challenging, health is a marathon, not a sprint. Be patient with yourself. Celebrate small victories. Learn from setbacks without dwelling on them. Keep going. One last thing I want to emphasize. Your blood sugar is feedback, not a judgment. When you check your blood sugar and see a high number, that's your body giving you information. It's telling you that something you ate, something you did, or something you're experiencing is affecting your glucose metabolism. It's data. Use that data to make better decisions going forward. Don't attach shame or guilt to it. Don't let it ruin your day. Just acknowledge it. Take action to bring it down using the strategies I've shared, and commit to making choices that will prevent it from happening again if possible. You have so much more control over your blood sugar than you probably realize. Yes, there are genetic factors. Yes, some people have a harder time with this than others. But the lifestyle factors we've discussed, diet, exercise, sleep, stress management, these are powerful tools that work for everyone to some degree. Your body wants to be healthy. Your body wants stable blood sugar. You just need to give it the right inputs and create the right conditions. When you do that consistently, your body will respond. Your blood sugar will stabilize. Your energy will improve. Your risk of complications will decrease. You'll feel better in every way. Remember, you're not just managing a number on a screen. You're taking care of your entire body. You're reducing inflammation. You're improving your cardiovascular health. You're protecting your nerves, your kidneys, your eyes, your brain. You're extending your lifespan and improving your quality of life. Every positive choice you make compounds over time. Every walk you take, every healthy meal you eat, every good night's sleep, it all adds up. You're investing in your future self. And that future self will thank you for the effort you're putting in today. If you found this helpful and you want to learn more about the specific foods that spike blood sugar and how to avoid them, check out my previous video where I break down the worst offenders and give you smart alternatives for each one. Understanding what not to eat is just as important as knowing what to do when your blood sugar is high. So go watch that next. Thanks guys for watching, and I'll see you in the next one.